Imagine yourself dreading for that doctor to walk through that door of the clinic, taking you into the examination room and telling you you're pregnant. This happens to every single day for young ladies and women across the world. As stated by Gray in 2012 at the Huffington Post website, 2 in every 5 women in the U.S. forgo any type of protection during sex, saying they misjudge how likely they are to become pregnant. Hi, my name is Lori Talley, and today I'm here to inform you on some different types of birth controls, along with the health risks and effectiveness if used correctly. Birth control has been around since 3000 BC. Can you believe that? It's still hard to believe that we still live in a world with teen pregnancy at an all-time high and abortion rates. Birth control would not be what it is today if it wasn't for Margaret Sanger. In 1916, Sanger began a revolution in Brooklyn, New York, that forever changed everything. She opened America's first birth control clinic, laying the foundation for what is now Planned Parenthood Federation of America. Now let's take a look at a few different types of birth control that is readily available to anyone through your OBGYN or even Planned Parenthood. The well-known birth control pill, also known as oral contraceptive. These pills come in a 1 month all the way up to a 3-month supply and can range from $0 to $50 depending on your insurance. According to Fox News, in 2008 at foxnews.com, says that even though the pill is 99.9% effective if taken consistently, 2 in every 10% of women become pregnant each year while on the pill. Doctors say it's not the pill failing the women, but it's women failing the pill. Side effects while on the pill could potentially happen are periods, sore breasts, mood swings, and even blood clots. If you're worried about that you might not be able to get pregnant right coming off the pill, as stated by Dr. B in 2005 at parenting.com, 80% of women who want to get pregnant will get pregnant. As for the other 20% of women, it could take up to a year to get pregnant coming off the birth control pill. Let's examine a few more different types of birth control that you might have a little bit more interest in. The IUD, or intrauterine device, was approved by the FDA in 1968. It is a T-shaped device made that is inserted in the uterus. Now I'm sure you're wondering, how does this thing work? Well, there are 2 different types of IUDs that are available in the US, the copper Paragard and the hormonal Mirena or Skyla. Both devices are approximately 32 millimeters in length and work the exact same way by blocking any sperm going through the fallopian tubes to fertilize any eggs. The IUD can range in price anywhere from $0 to $850, I know, again, depending on your insurance. Some great advantages of these devices are that they reduce menstrual bleeding by an average of 90% after the first few months of insertion, and they also can last anywhere from 3 to 12 years. And they also decrease the risk of endometrial cancer and possibly cervical cancer. Some side effects include abnormal bleeding, ovarian cysts, acne. Although these might seem a little bit harmless, most dangerous side effect of them all is if the IUD migrates from its normal position in the uterus. In an article from the OBG Management in 2012, Goldberg and Braden defines reviewing the medical records of 170 consecutive women who had an ultrasound examination with the IUD in place, found that 17% of them had malfunction devices. And of those 30 women, 75% of them were presented with heavily bleeding and very bad pain, compared to the 35% of women who had their devices normally positioned. As stated by Stiffer in 2014 at Time.com website, says that the IUD is extremely effective with a failure rate less than 1 pregnancy per 100 women compared to the 9 pregnancies per 100% women on the pill that we just talked about. Normally, after removal of the IUD, it is safe to start trying to conceive, although it is recommended that you wait at least 1 menstrual cycle. According to Lyle S. in their 1989 article in the Journal of PubMed, 62% of women got pregnant within the first 3 months of the IUD removal. Another study shows that 56% of women conceived within the first 3 months of removal. Even though those statistics made you feel a little bit uncomfortable, let's jump into the next birth control. It's a little less nerve-wracking with limited to no side effects. the condom. Condoms are a thin plastic cover men wear on their penises during intercourse. Condoms are the cheapest birth control compared to abstinence. They are also easiest to find from your local grocery store to even the convenience store where you pump your gas at. Prices can range from $1 for a 3-pack or even $15 for a 36-pack. Although condoms are 97% effective against pregnancy and most STDs, if used correctly, they do not prevent against human papillomavirus, which is HPV, and it's a disease that can be passed along by sex or close skin-to-skin genital contact. It also does not prevent against hepatitis B, which can be passed along through blood, semen, more rarely saliva. According to Kate Williams, in the 2001 article in the Journal of Peer-Reviewed Research, condom breakage and slippage occurs an estimated 1 to 4% of the time during intercourse, putting the female at risk. Condoms do not put off as much risky side effects as the other birth controls we talked about, but common side effects could include allergic to latex, not 100% effective, and if used incorrectly, cannot prevent STDs. So in conclusion, there's so much to learn about birth control, including types, prices, and effectiveness. All will be taken into consideration all these statistics I've presented. Remember, ladies, what are the 3 different types of contraceptives that was discussed?
IUD, oral contraceptives, and condoms.
Awesome. All the contraceptives I described has enabled women across the world to complete education and pursue their dreams basically carefree. Again, not all methods are 100% effective except for staying abstinent. However, choosing from the pill, condoms, IUDs are great things to think about if you're currently or wishing to be sexually active in the future. Thank you.